Hello everyone. Today our topic is prehabilitation. Now the word itself tells you what it means. Pre means before, habilitation means making capable. So prehabilitation simply means preparing the patient and making them stronger before surgery. I am Brinda Ronika, working as a tutor in Tribhulam College of Nursing. So objectives of today's section is define prehabilitation, understand the difference between prehabilitation and rehabilitation, know the benefits, discuss the components, understand the timeline, identify the barriers, and explain the nurse's role. Let's go through all of them. First, definition. So prehabilitation is the process of enhancing the functional capacity of an individual to enable them to withstand the stress of an upcoming surgical procedure. This definition is by Carley and Sheedy. So, in simple words, it means we make the patient physically stronger, nutritionally fit, and mentally prepared before going into the operation theatre so that their body can handle the stress of surgery better and recover faster afterwards. Now, the difference between rehabilitation and rehabilitation. Prehabilitation happens before surgery. Rehabilitation happens after surgery. Prehabilitation builds physical reserve so the body is strong going into the operation. Rehabilitation restores lost function after the operation. Prehabilitation reduces surgical risk. Rehabilitation manages postoperative complication. Prehabilitation starts 4 to 8 weeks before surgery. Rehabilitation begins from postoperative day 1. Prehabilitation reduces hospital stay. Rehabilitation helps the patient return to their baseline function. Simple way to remember it: prehabilitation makes you strong before surgery. Rehabilitation brings you back after surgery. Now we'll see the benefits of prehabilitation. It reduces postoperative complications. It reduces the length of hospital stay. It increases functional capacity, meaning the patient strength and endurance improves. It reduces postoperative pain. It increases patient satisfaction. It reduces readmission rates. It reduces healthcare cost, and it speeds up overall recovery. Now we'll see the components. Prehabilitation has 4 main components: exercise, nutrition, psychological support, and lifestyle modification. Let's go through each one. Exercise prehabilitation has 4 types. Aerobic exercise like walking and cycling done for 20 to 30 minutes 3 times a week. This improves heart and lung capacity before surgery. Resistance exercise using weights and resistance bands to increase muscle strength. Next, breathing exercise called inspiratory muscle training, which specifically strengthens the breathing muscle to reduce respiratory complications after surgery. And the last one is flexibility exercise like stretching and yoga, which reduce fall risk and improve overall mobility. Now, as a nurse, your role in exercise prehabilitation is to assess the patient using 2 specific tools. The 6-minute walk test, which tells you how far the patient can walk in 6 minutes and gives you their exercise capacity, and grip strength measurement, which tells you about overall muscle strength. These 2 assessments help set the baseline and monitor progress throughout the program. The second one is nutritional optimization. Protein intake is targeted at 1.2 to 1.5 grams per kilogram of body weight per day. This is essential for muscle building and wound healing. A carbohydrate ring is given 2 to 3 hours before surgery to reduce insulin resistance and postoperative nausea. And micronutrients like iron, vitamin D, and zinc are corrected in deficient. And anemia is treated with oral or intravenous iron supplements. And BMI is addressed by either reducing weight in obese patient or improving nutrition in underweight patient, and also adequate hydration is maintained before the surgery. And the third component is psychological support. Preoperative anxiety is extremely common. Patients worry about the surgery, the anesthesia, the pain, the recovery. Unmanaged anxiety increases stress hormones, which directly worsens surgical outcomes. So, as a nurse, we use therapeutic communication, which means sitting with the patient, listening actively, explain the procedure clearly, and addressing their fears. Relaxation techniques like deep breathing and guided imagery we have to talk to the patient, and family involvement also encouraged because a supported patient recovers better. And the last one is lifestyle modification is the fourth component. Smoking must be stopped at least 4 weeks before surgery, and alcohol also it should be stopped before 4 weeks of surgery because both impairs the wound healing. Okay, now we'll move into the prehabilitation timeline. It runs over 8 weeks before surgery. Week 1 and 2 is baseline assessment and goal setting. The nurse and the team assess the patient current fitness level, nutritional status, and psychological state. Goals are set based on the assessment. Week 3 and 4, the patient begins the exercise program and start the dietary changes. This is when the actual prehabilitation work starts. Week 5 and 6, the intensity of exercise is gradually increased. Progress is monitored. Psychological support also continues. Week 7 and 8 is preoperative teaching and readiness assessment. The patient is taught about what to expect from surgery and postoperative care. The team assesses whether the patient is ready. Then surgery happens, and because the patient has been prepared for 8 weeks, they go in stronger and come out faster. Next, the patient education in prehabilitation cover 5 things the patient must know: what the surgery involves and what to expect, why prehabilitation helps and how to follow the program, pain management expectation. So the patient is not shocked by postoperative pain. Postoperative care at home, so they know what to do when they leave the hospital and when to seek help, meaning what symptoms or warning signs should make them call the hospital. Okay, now we'll move into the barriers of prehabilitation. Patient related barriers include low motivation, poor understanding of the benefits, physical limitations due to existing illness, and fear of exercise. System related barriers include lack of time between diagnosis and surgery, lack of resources, unavailability of physiotherapists or dietitians, and no structured prehabilitation program in the hospital. And socioeconomic barriers, which includes inability to afford gym or equipment, lack of transport to hospital for sessions, and low health literacy. So, as a nurse, you need to identify these barriers early and address them. A patient who cannot come to hospital for sessions can be given a home-based program. A patient who lacks motivation needs a regular encouragement and goal review. Okay. Now let's see the nurse's role in prehabilitation. First one is comprehensive preoperative assessment, which should include functional, nutritional, and psychological assessment. Second one is patient education and counseling. Third one is coordinating multidisciplinary team. Like we have to coordinate with physician, physiotherapist, dietitian, and psychologist. Fourth one is goal setting and motivational support. Fifth one is monitoring adherence to prehab programs. And the last one is identifying high risk patients earlier. Now I just want to conclude with this beautiful quote. The best time to prepare for surgery is before it happens. As nurses, we have the unique privilege and responsibility to start healing before the first incision. That is prehabilitation in one sentence. We do not wait for surgery to happen and then manage the damage. We should prepare the patient so thoroughly that the damage is minimized from the very beginning. Thank you.